Welcome to Anatomy Coloring Book, page 26. This is Dr. Stephen Harkins. Cervical and thoracic vertebrae. It's important to know all the ridges and bumps and peaks and valleys on all of the vertebra, to know how they articulate with one another to form the vertebral column, and also to know where joints come together and where muscles and ligaments attach, and to get an idea of how they move and why they move the way they do. Let's start out with the atlas and axis vertebra. These are the top two vertebrae in the spine. And so you see them right here. We call the first, the atlas, we call that C1. And we call the atlas C2. C2. So here is the atlas C1. I will outline it for you in situ. As I said, it's the top vertebra and the skull. Here's the jawbone here. So we're looking at the person's left side. Here's the cheekbone, the zygomatic arch, the cranium, the skull. This is called the occipital bone back here. It's the posterior bone, bone on the back of your head, the base, the top of your neck. And in fact, the C1 articulates with the occipital bone. There are facets right here on C1. Facet is just a smooth, slippery space, the articulate where the joint forms. These facets form, they are right up here articulating with the facets from the occipital condyles. So there's a joint that's formed right here that we call CO, or occipit, the occipitoatlantal joint. And let's talk about the other parts of C1. The front is called the anterior arch. The anterior arch of C1, it's this area right here. The anterior arch, why don't we come back to this? The anterior arch right here of C1. What's the front of the vertebra? The transverse process of C1 right here. It's like the wing on the vertebra of C1 out here. And inside the transverse process is found what is called the transverse foramen. Foramen means hole. And it's not a nerve that passes through this particular hole. There's the transverse foramen right here, here, and here. Here's the transverse foramen of C2, of C3, of C4, of C5, C6, and of C7. It misses C7. But what is occurring there is an artery called the vertebral artery that runs down through the transverse foramen of vertebrae 1 through 6. And the heart is down here, and it pushes blood upward, and this blood goes through the transverse foramen and up and into the skull and into the brain. And so when the head is turned from right to left, a very peculiar area, especially right here where there's a lot of motion, C1 and C2, there's a lot of rotary motion allowed up there. And people have been known to, at the hairdresser, lean their head back and turn it, or turn their head you know, to look over their shoulder in the car and pinch that artery a little bit, and it can cause problems with blood flow to the brain. So we need to be judicious and careful when we extend the head, and especially when we extend and rotate it at the same time, to take care of that artery, make sure that vertebral artery is not compromised. Here you see the posterior arch of C1. This is the back, this is the posterior, this is the anterior. Posterior arch. And of course the vertebral canal right in the middle, where the spinal cord passes through up, and nerve signals go up and down through the brain and to the body. Now, note that C1 is intricately related to this C2 vertebra here. Here's C2, cervical number 2. Here's the inferior articular process. Here's what's called the spinous process. Watch how they are interrelated. First, let's talk about the vertebra itself. This is the body. Oh, that's the C4 vertebra, never mind. But note, let me trace out the C2 vertebra for you. Look at this funny little process here that jumps up from the vertebra. That's called the dens. The dens. And it forms like it's a pivot point, you might say. Here's the spinous process. It's called bifid. A bifid spinous process with two, or it doesn't come, here it is right here. It doesn't come together it completely. It's called a bifid spinous process. Very normal. These are what are called the lamina right here. And here is the transverse process of C2. And this vertebra, and here is the vertebral foramen, or the transverse foramen, excuse me, where the vertebral artery goes through, like that. But note this, and here's the bottom of C2, the body of C2 right there. So it's underneath C1, and let me finish sort of tracing C1 so we're not confused. Yeah. C1. Bad job there. But you can see how C1 fits over the top of C2 in this manner. Here's the dens, or that process sticking up out of C2 vertebra. And this represents the atlas, or C1. I'm sorry, C2 is also known as the axis. The axis. So notice how the axis has this big process coming up here called the dens, and how the C1 vertebra, here's the body of C2, and notice how C1 wraps around and forms a circle around C2. The atlas forms a circle around and surrounds the dens. It lies on top of C2, but it forms a circle around the dens of C2. Here. So like I said, it forms sort of a pivot point. There's actually a ligament that keeps it on there called the transverse ligament that keeps it from, it holds it in there and allows it to act as sort of a pivot point to rotate around back and forth. In truth, a lot of motion, rotatory motion does occur around C1 and C2 between the atlas and the axis. And moving down, the C3 vertebrae here, the inferior articular process, the spinous process, the superior articular process, C4, the body, the superior articular process, the inferior articular process, spinous process, C6, the body, the superior articular process, the spinous process, the inferior articular process, body of C6, the inferior articular process, the superior articular process, and the spinous process of C7. This is called the vertebral prominence. When you are palpating, it's the most prominent bone on a person's neck. So as the neck, have your vertebra down here. One of them, the number 7, really pops out. It's before you get to your thoracic spine, your lordotic curve, or your thoracic curve, kyphotic curve. There is what's called the most prominent vertebra is the C7, and you can feel it as a larger bump, larger than the other cervical vertebrae. So they call it the vertebral prominence. And here it is, the superior articular process, the inferior articular process, and the body. Now let's outline a typical vertebra. Here's C4. Let's talk about the anatomy of it. Here is the body of C4. And incidentally, of course, you know what's in between all these vertebrae. Of course, this is the disc, the C2, C3 disc, the C3, C4 disc, C4, C5 disc. In between the bodies of all these vertebrae, C5, C6, C6, C7. Now, one thing to notice, you will not see a disc between C1 and C2. No disc between C1 and C2. No disc right here. They are just two facets gliding on one another. Two facets here, an inferior superior facet here, inferior and superior facet here of C2, and they simply rotate and glide on one another. Now, so these were I outlined the typical upper cervical vertebra, C1 and C2, and I told you about all the processes and condyles on there. And now the typical vertebra, those aren't typical vertebra. Typical vertebra looks different. A typical vertebra looks like this. C4, C3, C4, C5, C6, C7 look more typical. They look like this vertebra here with a body. And what is called a, so the body, then the pedicle. Pedicle is this little area right here. The pedicle coming off the body to the, so that's the, let's make them in different colors. The pedicle, let's make it red. It's like a bridge between the body and the articular process. H is the articular process where of the superior articular facet that interacts and joins and forms a joint with the inferior process of the vertebra that's above it. And what we have here is called the lamina. This is called the lamina. It's a bridge out to the spinous process. And these are the bones you can feel on the back of the spine. The spinous process. So this is the posterior, this is the anterior, the back and the front. And last but not least, the transverse process. This is the transverse process, like the wing sticking out to the side of all or most of the vertebrae. And of course, the transverse foramen, which contains which artery? The Vertebral artery. I'll make it red because it's got blood running through it. Where does it take blood? Up to the brain. From the heart. So we have the pedicle, transverse process, the articular process, with this whole structure here, the articular process, and then on top of it is the facet. Here's the articular process, and here's the facet inside. The lamina coming together to form the spinous process. Interestingly, sometimes in birth there is an abnormality where these two lamina do not come together. And what happens there is they don't come together and they leave a gap right there, and the spinous process is not formed. And you could see how that would leave a gap right here and a sort of a hole in the spine where the spinal cord could kind of press outward, or it leaves the spinal cord vulnerable. That's called spina bifida. Bifida. Okay, and here we are, lastly, this spinous process. Now, how does the head and neck move? It moves in 3 planes. It moves in the coronal plane or the frontal plane, this way, side to side. We call that lateral flexion. Here's the atlas moving over, here's the axis moving over, and the cervical vertebra shifting over to the left in lateral flexion. This is the coronal plane. Lateral flexion occurs in the coronal plane. Rotation occurs in the transverse plane. This is around the what's called the y-axis. And this is in the transverse plane, and it's called rotation. So this is called cervical rotation, or neck rotation. And lastly, in the sagittal plane, we have the movement of flexion and extension, forward and back. Flexion and extension. Of course, this over here is called right. Excuse me. This is called right rotation. Over here would be called left rotation. That's the view from the front. And then the view from the back over here, this would be called left lateral flexion. This would be called right lateral flexion. The thoracic vertebrae are pretty much all typical. There are no unusual thoracic vertebrae. Like in the cervical spine, the atlas and axis are called upper cervical, UC. They're different types of vertebra. They have different shapes than the rest, but these are all pretty typical. And we call them T1, T2, T3, T for thoracic, of course, T4, T5, T6, T7, T8, T9, T10, T11, T12. There are 12 thoracic vertebrae, and there are 7 cervical vertebrae. And so let's describe the parts of these thoracic vertebrae. Notice this curve here called a kyphosis, where the convexity is to the rear, to the posterior. So here we have 2 thoracic vertebrae articulating with the disc in between them. Here's the body. Transverse process, the spinous process out here, and the inferior articulating facet here, and the superior articulating facet right there. And here is the body of the next vertebra, T2. Spinous process, transverse process, superior articulating facet, inferior articulating facet, inferior articulating facet over there. The transverse process out here. So what we have down here is a snapshot of how these of the markings and the dips and the grooves and the holes and the bumps on these vertebrae. And here is the vertebral body. This is the vertebral end plate here. Vertebral body. And let's make it easy. Let's start with the easy stuff. Out here, we know what this is called. This is called the spinous process. And of course, they are fused together. We have the wings. These are the transverse process. Here, this is the transverse process. Big bump coming out of the side of the vertebra. Here's the transverse process. Okay. On it, you find the transverse facet, transverse costal facet, or the rib. The rib is going to come out and form a little joint right there, a little synovial joint. Right here, here's a rib coming out. And if this rib were to come out of here, it would attach to that little facet right there. There's the transverse facet. It's attaching right down to the transverse facet of the vertebra below it. So that's where the rib comes out. So the rib would be something like, it would come out from here. This point here, the rib comes out like so, and it has a little bump on it right here, a little bump that meets along with that facet, with the transverse facet. That's what that facet is for. Now this right here on the vertebral body is called the posterior vertebral body, posterior lateral vertebral body is called the demifacet. Demi kind of means half. Here's another demifacet for the articulation below, for the next rib below. And I'm going to color in this here. And I'm just noticing you can see the outline of a rib underneath, but I think I did a better job of drawing it. But let's do it just for fun. So this rib right here would articulate with this costal transverse facet, as well as this demifacet right here, and the demifacet of the vertebra that would be above it. There's a demifacet right here, and a demifacet right here. And the rib articulates with both vertebrae, as well as the transverse process of a single vertebra. So this would be called the superior costal demifacet, and then this would be the inferior right here. Because the one's on the inferior part of the vertebra, one's on the superior part of the vertebra. Even though, to make matters more complicated, even though it is the inferior demifacet that articulates with the superior part of this rib, and the superior demifacet of this vertebra, which articulates with the inferior part of the rib, that head of the rib. So that is the vertebra there. Now, that's not it though. We have more. There are other parts of the vertebra, for example, the lamina. The lamina is where the area that brings the spinous process together. The two lamina meet in the middle and form the spinous process right here. Just as it did right up here in the cervical vertebra. Lamina is obviously shorter right here. Now, tucked inside there, we have the pedicle. Remember, pedicle was the bridge from the body to the articulating articular process. Kind of a bridge between the body and the next area here. I don't want to ruin it with color right now. Okay, next we have the articular process and the articular facet. Let's make them in yellow. So this is the articular process, just like the articular process was, oh, it's in blue up here. The articular facet and the articular process on the cervical. Right? Well, here we have the articular process and the articular facet. And again, over here, the articular facet and the articular process. And tucked away in there on the other side, you can see the other bridge on the right-hand side, pedicle. That's the pedicle right here. And of course, down the middle, we have the vertebral foramen. Right down the middle, and that's where the spinal cord goes. Spinal cord runs right down, all containing all the neurons. Going to your brain to tell what the body's doing, and then it's coming from the brain to tell your body what to do. And of course, we have over the top of the rib here, we have the rib here, which we've described, yes. Coming out and around, and then we have a ligament wrapping around the rib because it is forming an airtight capsule, and it's a synovial joint as well. A little ligament on it right here, surrounding the rib joint. So the rib articulates at the demifacets as well as the costo-transverse, the transverse process, costo-transverse joint. That represents the end of page 26, thoracic, cervical and thoracic vertebrae. This is Dr. Stephen Harkins.